From the living room to the Senate floor, from first responders to technology innovators. Different roles, different stories, but one goal: to meet the need for crisis care and overcome the obstacles together. So join in. The Crisis Jam is starting now.
Welcome, everybody. My name is Megan Haupt. I'm Chief of Staff with the National Association of State Mental Health Program Directors. And you are starting, beginning here today at Season 6, Episode 244 of the Crisis Jam, Being There for Youth. We have Sophie Szew. Just really excited to hear from Sophie. And let's move to the next slide. Great. So we have top 3 episodes of the Crisis Jam. And you can see the numbers here. The interesting part about the Battle of the Bills in particular, that used to be the 3rd most viewed. Now it's the 2nd most viewed. I think that really speaks a lot to how that's really catching on. It's really getting some teeth about that. And notice the live and on location from Franklin County Crisis Care Center in Ohio is the 3rd one. Wow, look at all those. Look at all those views. And then that's the 1st one. And then the AI one is the 3rd one. So crisisjam.com, that's our website, Shaping the Future of Crisis Response Together. You can find all kinds of different episodes, information at crisisjam.com. And so let's move to that next slide. Great. So you can tune in, log on, join the movement. We have the Zoom, you can register, you've got YouTube, you can watch a live stream. We've got the newsletter, but we also want to get to what was last time on the Jam. And that was the debate. States should prioritize building capacity in 3 core services. One of the 3 core services, Paul Galdis, really emphasized that. And Dr. Joe Parks really talked about a set of about 11 different components to the crisis service and kind of how do we approach it the best? And the way that we had pre-debate results, during these debates, we always want to get a sense of where people are. And you can see a lot of people didn't know kind of how they felt about things. There was a definite no of 46%. This was, should we focus on just the 3 core services, not a broader crisis continuum? The 3 core services were Paul Galdis. The broader crisis continuum was Dr. Joe Parks. Definitely no was 49%. Don't know was 19%. Definitely yes on the 3 core services with 32%. But then we had a pre-debate was less than that. People didn't know. There you go. And then the post-debate, people really went to the yes around focus of the 3 core services. More people kind of pulled that way. But notice the consensus of the 49% were definitely no. Very interesting. More of a consensus around focusing on the broader continuum. And again, at crisisjam.com, you can like and subscribe. You can look at those past episodes. There are hundreds, lots of videos, etc. And now we're going to go to the news, breaking crisis news. We're going to go to Monica Oss, who is going to be talking. She's the CEO of Open Minds. Monica, can you tell us what you have to share with us today?
Well, I wanted to talk about or share some of the perspectives of the provider organizations that are building crisis capacity in the system. I think one of the most exciting things that's happening is the leveraging of technology in the crisis system, the ability to kind of manage to performance dashboards, to use technology to help with disposition for consumer treatment, kind of the interoperability within geographic areas to link crisis providers. I mean, it's really an exciting time, Megan.
Wow. Can you say a little bit more about what technology they might be leveraging?
Sure. We've done a deep dive into a few key pieces of technology that we think are really exciting for the crisis system. Recently, at one of our kind of meetings, we highlighted a group in Georgia, Avita, that developed, using their EHR platform, a series of performance dashboards to track throughput, productivity, consumer outcomes across the crisis services they offer. The net result is in less than a year of like 200 to 300% increase in their ability to serve consumers. So part of it is using data for performance management. We have worked with organizations that are using EHR systems to capture crisis events and route consumers to appropriate referrals, and even using smarter phone systems to kind of help channel consumers to the right people within a particular provider organization. Just an explosion of really exciting tech activity.
That is really exciting. We encourage everybody to look at that article, that Open Minds information. Monica, thank you so much. We're really
I'm
excited about
pleased
that
to
work.
be here, and I'm a big fan.
Wonderful. Thank you. We're now going to go to the Crisis Jam hot seat. Let's bring up the hot seat participants, which are Gowrie and Satira, I believe. Yeah?
Satara.
Satara, I'm sorry.
No worries.
Hey, Satara, thanks for letting me know. All right. So this is your chance. Anybody that works as a team, we always have a team for the hot seat. You get the chance to get Crisis Jam swag. So you'll get like a voucher type of thing, a gift code that you go on site and you can get a t-shirt or a voucher towards some of that swag. It's excellent. I got a shirt myself. So let's do this hot seat Q&A. Take a look. All right. So the question is, before becoming a national youth voice, writer, poet, and mental health advocate, Sophie Szew was part of which leadership pipeline? So let's take a look. A is NAMI Next Gen. B is MHA Mental Health America Young Leaders. JED Youth Advocacy Coalition is C, or D, both A and B. So go ahead and talk it out. And also let us know a little bit about your backgrounds and why you think you are asked to answer this question. And the audience, go ahead and put your answers in the poll there.
Do you want to start, Gowrie?
Sure. I used to be part of the mental health system in Arizona, with the entire system of care, and I'm still there. I consult with a lot with data, so I really like what Monica was saying about data, and I really do a lot of consulting around data for mental health on the commercial side as well as on the public sector side, and I'm happy to be
Great.
here.
I am a recent undergraduate from ASU Barrett. I just got my BS in neuroscience, and so I'm very new to the field, but I'm learning so much, as you can imagine, just starting out. And so I think I can provide a good, insightful lens just as a upcoming youth trying to be a part of public health and make a name for myself in the community.
How cool is that? Well, welcome to the field, Satara.
I appreciate
breaking
it.
new ground here. So what do you all think as you talk this through?
I am thinking, at first I was just initially drawn to B, but because both A and B are options, I'm leaning towards that. What do you think?
Me too. I was thinking both A and B.
All right. It
All
looks
right.
like, it looks like the people have also voted in favor of A and B.
Exactly. So is that your final answer there?
I think so,
Yes.
yeah. D.
Great. Well, let's take a look. Yes. So Sophie came up through MHA's Youth Leadership Program, then joined NAMI's Next Gen, a dual launch pad for rising youth advocates. Sophie has done incredible work. And just like you, Satara and Gower, you guys do great work. And there's so much ahead. And we look forward to learning from you. Let's also do over under. I don't know if you guys have seen this before, but this is a cut the cookie, right? So one of you there'll be a question, one of you will identify a number, and the other person will do is it more than that or less than that, over or under? Who would let's look at the question and see who wants to do the number, okay? It could happen at any time. Eventually, your kids may want their own social media accounts. Oh, I want to download so-and-so. Okay. So what's the average? I'm whining like my kids. Okay. That's right. What's the average age when kids get a social media account according to CNN? Who wants to identify and kind of say a number?
I can say a number.
Go for it.
I want to say 13.
Okay. 13. And Gowrie, what do you think? Over or under?
Under.
Under? All right.
Yeah.
So we're saying under 13 is Gowrie. Satara said 13. Let's take a look. And of course, the audience, let's say, put what you think. The average, let's take a look. What is it? Okay, we're seeing different numbers. Some say 23. Okay, 10. All right, some say under. There's 11. All right, 12.6. Wow, you are super close. We're expecting that it's getting younger and younger, so we're not quite sure. It would be nice if it's, we understand there's some laws being passed in some countries that make it 14 or 15 at this point. So that would be great. All right. Well, thank you both so very much.
Thank you.
Thank you.
Look forward to seeing you again. We're going to go to our lead story. I'm introducing Michelle Zabel, who's Executive Director of Innovations Institute at the University of Connecticut, to have a fireside chat with Sophie Szew. So, Michelle, go ahead.
It's so good to be here. Megan, I heard you earlier about being in the Mid-Atlantic and how cold it is. I have my big sweater for my fireside chat, and I'm looking forward to this with Sophie. I do want to highlight, I want to give you a little more information about who Sophie is. So she is a poet. She's a youth mental health advocate and one of the youngest appointees to the U.S. federal government, where she serves as the National Advisory Council for SAMHSA. She's been a youth leader at the MTV's Mental Health Youth Action Forum at the White House and a 3-term intern at the U.S. House of Representatives. She's advised numerous organizations, including Lady Gaga's Born This Way Foundation, Mental Health America, and the California Mental Health Consortium, where she has testified in front of the judiciary and helped really bring about $100 billion in mandatory funding for mental health services for youth in California. She's founded the Youth Latinx Leadership Conference, where youth came together to talk about mental health and social media. She's been covered by the Today Show, the LA Times, NBC, and CBS News. And in her spare time, she is an internationally recognized poet. So I want to welcome Sophie and thank her for her time. I got a chance to be with Sophie and prep and get ready for this event. And so I really think that you guys will be so glad that you get to hear from her. Soph, I am hoping that in the beginning, well, first off, was that an okay introduction? Is there anything else you want people to know about you? Because that's a lot. Like,
that
I'm
was
tired.
incredible. No, thank you so
Yeah.
much. I'm
I
again
mean-
so honored to be here, and I don't think I'll ever live down having been a trivia question on Crisis Jam.
It will forever be that thing they ask you at conferences or, in groups where you were like, share a special thing about yourself, and you will always do that one. right? Yeah.
Absolutely, yes. No,
Yeah.
thank you so much for having me here. This is my second time on Crisis Jam, and I'm just very thankful for this community and creating spaces to really talk through these issues and align the mental health care that we provide and create policy around directly with youth needs is so important. And we really do that by having conversations directly with youth, by building community for youth and learning directly from them. So again, just incredibly, incredibly grateful for this platform. And I'm very lucky to have met Michelle during prep as well and just really admire her work and admire everybody here. So very excited to dive in.
Yeah, so let's get to it. So I really want us to start with kind of big picture. So if you could talk with us about so the topic for this is being there for youth, right? And you and I agreed that we were going to really focus on young adults. So the audience should know that. Like we're not dipping down into 12 and 13-year-olds. We're really trying to stay with young adult populations and what they think we should be doing to do better work for and with and how we can evolve. So as we get started, can you help us think about what the essential issues are that really takes to create community and provide foundations for our youth families and communities to thrive? What does that look like for you? What does it just general support need to look like for young adults right now?
Yeah, I think a lot of the discourse right now about youth mental health is about how we are in crisis and we're all facing this huge mental health crisis that's this enigma, and we have to do everything in our power to stop it. And I don't want to deny the reality that like this language and framework of crisis was so important to destigmatizing mental health, to talking about mental health, to beginning to have these conversations. But the reality is that when we talk about mental health as a crisis that we need to kind of jump in and intervene with, we really deny the language and access to frameworks of agency, which is really what young people today want. They want to see themselves as change-making agents within their own communities, and they want to feel empowered. They want to feel empowered to find ways to support mental health within their own communities. That's why I really resonate with ideas like peer support that we're seeing increasingly talked about. So I'll say this, multiple times, where it's like a lot of the way that we include youth in conversations now is giving young people a seat at the table. We're inviting them a little bit more into spaces where we legislate about mental health, where we create resources for mental health. But the reality is that young people have been creating these resources for themselves for a long, long time. So it's really time to almost sit down at the youth table. There's a table out there. We are invited to sit down, but we've been feeding each other on the floor. So we're really asking people to kind of sit down with us. We're inviting you onto the floor to see what this groundwork really looks like. And I think a lot of what gets lost in that is the ways that we do communicate those mental health support resources. A lot of it does happen in the digital world, and a lot of it does happen around social media. And I think that a lot of us feel that we're getting that discourse and legislation around social media wrong as well, because it's not necessarily about blocking off our access to it entirely, even though there is a lot of harm being done on social media. And I don't want to deny that. And I've spoken out about my own lived experience with that very publicly. But the reality is, if we really protect and make social media a safe space, young people can continue to provide each other that support through these mediums. So I think it's really important that first and foremost, we ensure that young people feel safe to provide each other with the care that they've already been providing each other with. And I think that's like the very first step. So again, it all goes back to agency. Like we are providing each other with this care. We are telling you what we need in order to do it. So it's a matter of listening and working with us rather than stepping in and intervening and kind of creating more of a panic around this crisis.
Yeah, I loved your metaphor of we've been eating on the floor. I talk a lot, right, where people need to understand what table to join so that they can have their voice heard and so on. And you're really reminding us that we still need to join tables for youth, like not set our own, but join where youth are at, where they feel like they can speak about what their needs are and so on. So let me ask you a little more personal question. When you yourself have experienced adults, listening, being heard, helping, support, so that it's supportive and leaves you with agency, what has that looked like for you? What's an example?
Yeah, I mean, I can go about speaking about this in two ways. One is when I was really deeply struggling with my own mental health. I
Mhm.
think the most supportive person in my life at the time was my English and creative writing teacher, who rather
Mm,
than speaking for me, encouraged me to speak and encouraged me to write. And that was
yeah.
the first time in my life I really felt like I could create something, like I had agency, like I could try to apply language to what I was experiencing. And with that
Mhm.
language, start to talk about the systemic issues that were impacting me because so
Yes.
much of the language around mental health right now is also so individualized.
Mhm.
And it's all well and great, like telling young people to get more sleep and get off of their phones, but that's not going to solve the underlying systemic issues
Yeah.
at all. And quite frankly, it causes more cognitive dissonance. Like, I'm
Mm.
talking to young people who are terrified that their families won't be able to afford food. I'm
Yeah.
talking to young people that are really scared to go outside right now.
Hmm.
And then you're telling them to, you know, get off of their phone and that social media is the
Yeah.
problem or that they need to get
Exercise
more
and eat
sleep.
right, right?
Yeah,
Yeah.
which is,
Yeah.
again, great advice, but not getting to the core of the issue. And then it makes it feel
Yeah.
like it's on us. And the
Right.
reality is, no, it's systemic. And when we can
Yeah.
point that out and build power around that and have
Yeah.
conversations around that, that is where we really start to do that healing. And that's why I think we also need to reframe healing not as an individual thing, as a collective
Mm.
thing. And I
Yeah.
think that really first happened to me when I began writing creatively, when I began writing in
Mhm.
community with my creative writing teacher at the time. And that's kind of like on the mental health support side of things. On the
Mhm.
building power and mental health advocacy side of things, I really am incredibly thankful to platforms like MHA's Youth Leadership
Yeah.
Collective and just to so many different organizations right now that are starting to give young people that voice and that space to really lead
Yeah.
and to really have these conversations and to build power because I found so much community with other mental health advocates.
Hmm.
And that's really been very important for my own mental health. I think
Yeah.
like these people truly are my community. And I think that it's really important that we center that too, because a lot of times young people are kind of framed as these mental health advocates, voices of their generation. So, however that might look, but we forget that they are also young people that have their own mental health to take care of
Yeah.
and that they don't speak for their entire generation. I mean, I certainly cannot do that.
Yeah.
I have immense privilege. I'm talking to you from Stanford. My experience is so different from other
Yeah.
people in my generation. Um, so I think it's really kind of, again, this like reframing of like, yes, holding spaces for young people to have these conversations between each other, but
Hmm.
remembering these conversations are where it ends, and we shouldn't take them
Hmm.
as representative. We should take them as individual experiences that can give us insight into what's happening.
Yeah. Really powerful. Thank you. So when we prepped, we also kind of delved into this conversation about that we're having as a country, really as a world, around this epidemic of loneliness.
Mm.
And people put that not just on your generation, but we see it with like 40, 50-year-old adults as well. So it's not just generational, but it's truly destabilizing as a society, right? And so, and I do think it's core to some of what's happening with youth mental health, right? This idea of loneliness. And I'm just wondering, given that we have this need for connectedness, your role in conversations around social media, what do you think is going on in terms of digital lives and how that is affecting us for better or for worse? What's your
Yeah.
thinking on that? Yeah.
That's a really great question. First of all, I always kind of try to start with the positive on social media a
Mhm.
little bit just
Yeah.
to reframe the narrative and break up some of the, I think, very real and very valid anxiety we have around what's going
Mhm.
on. But lots of youth, especially marginalized youth of color, queer youth, do find community on social media that they don't necessarily have access to in their non-digital lives. They find affirming and real
Yes.
communities, and those save lives, and those are
Mhm.
necessary to protect.
Yeah. Yeah.
I'm going to be very transparent on my stance on this that, if protecting these communities means that we save the life of one trans person who would have otherwise not have access to that life affirming community, then I don't think any kind of regulation is worth it. Because who are we
Yeah.
trying to protect here? It's youth,
Yeah.
it's young people, and it's young
Yeah.
lives.
Yeah,
Um,
I think every single person should be hearting you and putting something in the chat right now. But that's me, but 1,000%. So,
Thank you.
yeah.
So yeah, I want to start off by saying that young people truly are building communities online. I'm someone that has been trying to do a lot of learning about disability justice, and that has been a very rooting and guiding force in my life. That's been a lot of my community. That's been a lot of how I've found healing for myself. And disabled people online have been building community for so long because it's so much more accessible to organize online. So these are just two examples of overlapping communities that are finding spaces for community and for healing in the digital world. With that being said, there are a lot of young people that do interact with the digital world and experience a lot of harm. And that's because these platforms are systemically built to profit off of it. And that's something I've spoken up about a lot about, these communities that can include pro eating disorder content or pro self-harm content. Young people spend a lot of time on them because, well, quite frankly, that's the purpose of them. You engage in these behaviors, then you seek out more content, and it's kind of a cycle. And because the model is the more time spent online, the more ads you receive, therefore, the more money these platforms get, they are incentivized to expose young people to that content. And I think that's something that we absolutely need to interrupt directly head on. And that has not been done yet. And these kinds of communities, even though they might at first glance make young people feel more supported and seen in a way that they might have not felt before. They are at the end of the day harmful, but we have to recognize like people are spending time on these platforms because they don't feel supported in their day-to-day lives. They don't feel affirmed. So it's really important that we center in real life community if we want to address the issue of this harmful content spreading, especially when it's interpersonally between young people. Because really what's happening right now is that the onus is being put on young people themselves to delete those apps, to get out of those spaces, where we can prevent people having to feel like they need to be on these spaces in the first place if they truly do feel supported in their daily lives, if they do feel affirmed. Even if you don't understand it, attempting to recognize it can go a very, very, very long way. So yeah, I can at least speak from my own experience. Like I've been equipped with so much language to make my experiences feel real in a way that they never have felt before through social media communities and social media platforms, for better or for worse. I wouldn't have had, the eating disorder I experienced, like that, the language around the behaviors I was beginning to engage with, I wouldn't have even had that. And that made it more real, and that in turn might have reified my behaviors. I don't know. But also, as a young queer person, social media for me has been a very affirming space. So it just really does, it really is important that young people have access to that affirming language and community in their real lives. And then when it does happen on social media in a protective, empowering way, that we protect that as well.
Yeah, really a complex issue. Thank you for sharing and for sharing your personal story too. I appreciate that very much. Thank you. So this is a crisis jam. We are having an experience in our country of really standing up services for youth and families that haven't been there before. And I'm just wondering if you have thoughts about what support systems, and we can, given the time frame, stick with crisis support systems, but support systems should look like for young people of your age, right? So we're going to go 18 and older. So let's pretend 18 to 26. A lot of times, we fight hard in the kid system to have customization for younger children, right? Not just have it look like adult service systems. But in doing that, a lot of times young adults don't get the same level of advocacy for having customized approaches, and you just kind of end up in the adult system. So I'm just wondering if you have thoughts about that. If there's anything that you think that everybody running systems here should hear from you.
Yeah, again, agency and affirmation are absolutely key for my generation because that's something that we feel we have been denied for a very, very long time, especially with this framework of social media and mental health crisis. Crisis denies agency, and I think it's really important that any kind of intervention we have in place, young people's voices are directly taken into account, especially when we're talking about youth that are 18 and older. Like that agency is important. I think it can be very scary to let go of these frameworks of like, we have to intervene at all costs and protect this notion of health. But your notions of health might not align with ours. A lot of us are starting to let go of that. That's a very key tenet of disability justice. And for me, that's something I recognize too. I will never be quote unquote healthy in a way that is quote unquote normal in the way that the medical
Yeah.
system wants me to be.
Yeah.
And part of my own agency is knowing that and recognizing that. And I think for a lot of us, being able to make choices around that. So again, it's a scary thing to hear. It's a scary
Yeah.
thing to let go of, but I think it's very important and an absolutely necessary step to actually start to dissipate this crisis. So that's part of it. Another part of it is actually rooting crisis response in community. So really, truly, young people feeling like they have folks their age or not that they feel seen and affirmed by and heard by. This kind of reframing what it means to be cared for and to provide care, I think can be very, very important. And I think for me, I really couldn't begin to start to think about healing my own mental health until I began to think of my role in healing systems that cause disorder. We can't really, we don't have disorders without disordered systems. So I think it's really, really important that we actually, once we kind of like get to that point of having young people in treatment in community, that we begin to talk about these systems and again affirm and acknowledge that what young people are feeling is real, and that we equip them with the language to talk about that and also acknowledge them as people that can make change. I think like the most, again, there's a lot of results that will come out with time, but I really truly believe that the best outcomes for young people in terms of mental health comes with those who are told and receive feedback that they are capable of creating changes in their communities. So I think that that's really an important narrative to center.
Yeah. It's the listening and taking action for people that have, the capacity to do that for youth as well, for young adults. Yeah. So it leads us to our last question, Soph, where if you had a wish for every adult, what would you want them to do for young people, for young adults? If you could tell an adult, if you could tell me what you'd like me to do, what would that be?
Yeah. I think I've said this again, but I'm just going to drive the point home. Acknowledge and support our agency, and remind us that like we are empowered to create change and that our own healing is contingent on everybody's healing. I think like if every adult could understand that we all view our healing as interconnected, that we all view this crisis as systemic. It is not my mental health crisis. I live in a system of crisis, therefore, this is what I am experiencing. If we can have our intergenerational partners, if we can have adults in our lives understand that and really, really approach us from that framework, I think that we really can do a lot of work to create a better system, and we can really do the work of starting to provide care that's really truly rooted in our needs and in our own perceptions of reality, rather than this very false notion that the crisis is extremely individualized.
Yeah. Thank you. Thank you for your voice. It was great. Thanks, Sophie.
Thank you.
Yeah.
That was incredible. Michelle, thank you. Thank you, Sophie. Just so insightful. I hope you see the comments and the support in the chat. The idea of agency and the systemic piece around that is so critical. I wanted to bring up the round table, Kelly Davis, as well as Satara. Let's start with Kelly. Kelly is the Vice President for Peer and Youth Advocacy at MHA. Kelly, this was the kind of the youth council that Sophie was part of and was brought up in that sense, correct? Yeah. So Kelly, if you can talk a little bit about yourself and what is your response? What do you have to add? What are your thoughts?
Yeah, hi everyone. I'm Kelly. I use she, her pronouns. This is a little dated. I'm in my second year of the NPH program at the Harvard Chan School. I'm a person with lived experience. Excitingly, today's my birthday, and I am about to submit my first IRB approval as a PI on a study about digital mental health tools and youth peer support. So youth peer support, really has been fundamental to me since growing up with, my own mental health challenges and suicide attempts. I think one of the, well, I guess to speak to my work at MHA, I started as a high school peer support advocate, college peer support advocate, and then have been doing, oh, hi, Kelly, have been doing youth leadership organizing and advocacy for peer support for the last 10 years. We have a national youth peer support policy leadership program. I think for me as a person with lived experience, who had access to a million things, one of, I guess, like two of the most important things for me are, well, I guess first I'll say, Sophie, one of the things that we prioritized in our youth leadership report for a few years ago was the importance of intergenerational, not just collaboration, but intergenerational learning. I think one of the things around like hopelessness and isolation right now is, especially within the US, there's always been this narrative of things getting better and opportunities coming up, and it does not feel that way for a lot of young people right now. And the wisdom of folks who have survived, we interviewed someone who was an activist during the AIDS crisis after 9/11. And I think that there's so much wisdom about sustaining and community that can be offered by older generations in collaboration with young people. So it's not just about kind of listening, but also about learning and growing together, because all of us, have our specific experiences, and part of being a human being is fighting and learning how to keep going in community with others. Do you want me to? I do have a couple of thoughts on the youth peer support thing specifically, but I did not ask questions about how long I'm supposed to talk, so I don't want to take up too much time. If Satara wants to do an intro.
Yeah, so let's, if you could just take a minute to talk about that, that would be great.
Yeah, I think for me, I totally agree with Sophie's point that advocacy was really important for me as a young adult because it gave me a sense of agency. It gave me a sense of there's something to hope for the future, and that I belong somewhere and am part of something bigger than myself. So the sense of purpose, connectedness. From my experience, trying to start a peer support program in my high school, I think that I've been doing this advocacy for about 10 years. I think it really was like COVID that made people not super afraid of youth peer support. I think that's still kind of there. Young people are already supporting one another, but I think there's two real major things that for me made youth peer support and peer support particularly helpful. I think first, especially when we're talking about crisis systems, there's not very much transition support. So if you think about, and I can use one of my experiences, when I was 16 and hospitalized for a suicide attempt, I remember, I had access to all of this stuff, and, there's lots of problems with quality and all of that. But the thing that nobody seemed to appreciate was that I just went missing from school for 2 weeks. I was like an AP, multi-AP student, and I had to explain to everyone where I was. And there's so much, I think, at the transitions when you interact with crisis services, that having someone who understands and who really gets and has been there is so powerful, because it's not just the yes, it's great to have all of the places to go and evidence-based care and all that stuff, but I think the actual experience of having to be a person in the world when you're not in, a 60-minute session, 45-minute session in an office every week, is really kind of the humanity and the thing that makes people feel like they belong. And the belonging thing too, I just want to add, part of, I think, what's really powerful in working with young people is that, are we allowed to they'll call you out on your bullshit, right? Like, they know if you're being honest or if you're not. They have very strong BS detectors. And I think that a lot of the messaging around crisis is really important and really powerful. And at the same time, people will say that they want to be supportive, but if you have been in a crisis or talk about wanting to kill yourself, most people do not respond well. So having folks who are trained, who you can go to, who get it, but also making sure that training is not just about crisis intervention, but about ongoing care and support. Because I know in my experience and from a lot of work with young adults is that if we're treating the importance of like suicide prevention and mental health advocacy as solely threat detection and referral, I think that it can actually be really dehumanizing and can make you less likely to share because you're like, people are afraid of me and they feel like I'm a liability and not that they want to provide ongoing care. Problems that clinical services cannot necessarily address in the same way.
Kelly, that makes a lot of sense. And thank you for your insight and for sharing your personal experience. Really appreciate that. And so Tara, what are your thoughts? And in addition, maybe adding to what Kelly was talking about, or let us know your thoughts.
Yeah, I just want to say thank you, Kelly, for sharing your story about just your peer support and all of that. It was amazing to hear, and I think it's a perfect segue into what I wanted to bring up as well. And again, thank you, Michelle and Sophie, for leading such an amazing discussion. Sophie, you are an inspiration, truly. You speak so passionately and so beautifully. It was really amazing to hear you. And I did want to kind of circle back to this idea of the loneliness epidemic and this lack of support and the idea of adults specifically, I guess older adults, not taking young adults seriously or not having the platform to speak out about what they want. And at least in my experience, it's been difficult navigating the field right as I just graduated. I'm wanting to get involved. And I think there's this feeling of not feeling experienced enough or not feeling capable enough to do hard work or to go into a very difficult field. And I think even just being invited here, I think it gives me a platform to express my my draw and what is drawing me to mental health. Me being able to speak out about this and learn about all of this is a support in itself as someone who wants to be an advocate for mental health, who wants to be an advocate in public health. And I think having platforms like this and people who will take you seriously from a young age, regardless of your experience, is so important in just getting your foot in the door to want to make a difference. And I think when it comes to having a platform, I know Sophie talked about social media being that platform for many, but there is such a divide in social media because it is the younger generation who are using it more predominantly. And to bridge that gap would be to have a platform where you have maybe an older peer support. So adults coming in, wanting to bring in youths, bring in undergraduate students, graduate students, people who really want to make a difference but don't feel as if they have a place because they don't feel as qualified. So I think something along the lines of, yeah, having some sort of social media group or anything that even advances social media to bring in all generations of people for the same cause is something that I can benefit from and I am benefiting from. And I think that definitely ties in with my own experience.
So Tara, thank you. It almost sounds like mentorship to me. People that have been there, but also have truly lived it, right? But they've got some experience and then how to move ahead with that. But also, I imagine listening to your voice on how to do even more. Like what's needed. It's not just, hey, I've done this. This is how I did it. It's what do you think? What do you think we could do more of? Right? I'm just curious about that. But
Yeah, definitely. I think social media being as big as it is as a platform, I think there are ways, maybe there could be a new platform for the purpose of bringing, I guess, veterans in the field and bringing students together in a way to engage. So, say a Facebook of sorts, but for the purpose of advocating for mental health, general public health. And that would be a really cool way to engage people. There could be, you could post about it. There could be the same sort of interaction that you would have in a normal social media platform, but it could be solely designated for the cause. I think that would be amazing. It would be a way to involve everyone. And I think that would be a really interesting thing to come up with if if someone can.
Great. Thank you so very much for being on twice today. And let's move to Dr. Richard McKeon for the briefing room from SAMHSA. Dr. McKeon, we are so happy you are on. We're happy SAMHSA is back. And so just a joy to see you. Please go ahead.
Thank you, Megan. I am so glad to be back, and to regretted not being able to participate during the time of the federal government shutdown. As most of you probably know, that the federal government shutdown finally ended last Wednesday evening, when the president signed a continuing resolution that had passed the Senate and the House. And that was passed Wednesday evening. On Thursday, all federal employees who had been furloughed were back in the office, including me. So that was certainly welcome. What was also welcome was that there had been, in the early days of the shutdown, there had been reductions in force, including a significant number of people at SAMHSA. As part of the agreement to end the shutdown, those reductions in force were rescinded. And so just earlier this week, the people who had been impacted by that were also able to return to SAMHSA and the other impacted federal agencies. So it's been great to be able to see people that we've been concerned about, in the halls of SAMHSA. And I'm sure that other, federal employees are feeling the very same way. At the next Crisis Jam, I will have a more substantive, SAMHSA report. Of course, SAMHSA's grants and contracts were continuing during the period of the shutdown, but oftentimes the people who were overseeing them were furloughed. So it was more difficult to get a hold of someone who you might have had a pressing issue to talk about. But everyone is back now and available to respond to the needs of grantees, contract recipients, and more broadly, the needs of the American people. So again, thanks for the time today. Great to be back. Looking forward to future crisis jams as well. And so glad that these are recorded, because it will enable me to catch up from crisis jams I was unable to be on.
Dr. McKeon, thank you so much. It is such a pleasure and joy to talk with you today on so many levels. So thank you. We're now going to move to the briefing room with NASHBID. We have Wendy Morse, who's the Senior Behavioral Health Advisor for NASHBID, and to talk about Behavioral Health Workforce Resource Guide. Go ahead, Wendy.
Thank you, Megan. And it's such a privilege to be here today and share some of the great work that we do at NASHBID. And as Megan said, I'm going to talk just for a minute about what we've been learning about workforce development, some progress and opportunities across the states and territories. So we do have a behavioral health workforce resource guide. We just released the 4th edition in September, and it really highlights state innovations and initiatives for workforce development. You can get the full document with the QR code here. And for those of you who have seen our previous editions, we very clearly tag what's new and what's updated, so you can quickly find that. And even if it's your first time, you'll be able to see what's most contemporary very easily. So some trends that we're seeing, first is a real uptick in states taking the time to really understand what their workforce needs are and where they want to make their investments. So landscape analyses, dashboards, special legislative sessions and committees that are really digging into this. Development of task force, centers of excellence, and a lot more states are developing behavioral health workforce development centers like the one in Nebraska. And in fact, Nebraska has put together an alliance of all those behavioral health centers to create some synergy and move things forward. States continue to reimagine what that treatment team looks like. So revising job descriptions, expanding the use of peer support, other adjunct roles, increasing the use of technology are always, that's being done. A whole lot of energy and is being put into developing new entry programs. So this includes websites, ad campaigns, scholarship programs, apprenticeships. There's a behavioral health academy for high school students in a couple of states where kids are graduating with their mental health technician certificate ready to go into the workforce. Energy going to eliminating barriers to entering the field. So allowing provisionally licensed providers to bill and obtain reimbursement for services, providing supervision that's required to obtain credentials, some grant programs to pursue higher degrees, paid internships. Also leveraging technology, and we hear about this a lot on the JAM, but it's so important. Some ways folks are using it for workforce development is for onboarding and training, ensuring continued education through things such as on-demand learning modules, and web-based tools to support people who, for instance, want to join the peer workforce so they can learn how to do that. And then a lot of states have taken the time to improve wages and benefits so that the public sector can be more competitive with the private sector. That is definitely helping with retention. And then a lot of continued effort in creating supportive work environments, trauma-informed workplaces, and focus on staff safety have all been big initiatives. We do know that challenges remain, right? There continues to be a growing demand for mental health services. A lot of states are increasing their state hospital beds, which require significantly more staff than outpatient services. We know we have an aging workforce, and we want to be sure that we are bringing more people into the field than are leaving the field so that we have an overall uptick. And there's this issue of data continues, right? So we want to be sure that we're measuring improvement indicators and defining what those are. Is it increased access to care, more timely access, improved quality of care, an adequate workforce, and what does that mean? How do we demonstrate what the return of investment is for various initiatives? And how do we know which initiatives, right? Most states have many things going on. How do we know which of those is really yielding the results? Lots of states are starting to collect data. So I think we're going to be able to start answering those questions. We also have some, national organizations looking at that. So thanks.
Wendy, that's awesome. And I just so appreciate your awesome work with this. Wendy was interactive with states, very careful about how to organize things, what's been updated to make it as useful as possible. We encourage you to go on the NASHPID website to get this resource, and we'd love your feedback as well. Wendy, thank you so much.
Thank you, Megan.
All right, let's go to Voices in Crisis Care and go to Natalie Lawson. This is Georgetown University McCourt School of Public Policy Center for Children and Families, and it's about what state level data is available for the 988 crisis line. Natalie, it's great to have you here. Go ahead.
Hi, thanks so much for having me. As she said, I'm Natalie Lawson. I'm a senior state policy analyst for the Georgetown Center for Children and Families. We're a nonpartisan research center, part of the McCourt School of Public Policy, and we focus on making sure that there's health care for every kid and family in the U.S., and we focus almost exclusively on Medicaid and CHIP. So CCF is not an expert organization in behavioral health, but I started my career as a community mental health social worker in Chicago, working with low-income adults with severe mental illnesses and substance use disorders. Got into public health and policy from there. And actually, I joined CCF right as 988 was coming online. And given that mental health is so relevant for youth, I made the case to write an article for our organization's blog. And it's kind of become a mini series where we've explored the potential for Medicaid as a sustainable funding system for 988. I've looked at states that have their own data dashboards for 988 to get more granular data on the crisis line. Then the reason I was asked to be here was that I also collected the 988 key performance metrics published by the Lifeline and Vibrant from July 2022, so when it started, up until last month, so that state performance can be tracked over time. So the primary metric on the monthly reports is the in-state answer rate. We could definitely have a lengthy debate as to whether or not this is the most valuable metric. There's lots of other metrics included, but for now, this is the one that we went with because it is the primary metric on the KPI reports published every month. And as you can see on the screen, this is that blog that has these state-by-state figures. So there's a drop-down menu and you can explore all the states. And so I just wanted to highlight the top 5 states for in-state answer rate. So Rhode Island is number 1 at 99% in-state answer rate. Mississippi is at 98%, Montana's at 96%, and then Indiana and Missouri are both at 95%. A few honorable mentions are Minnesota, New Hampshire, and Guam, trailing closely behind at 93%. And then last but not least, I want to give a shout out to a couple states as the most improved states. So there are a lot of states like Rhode Island and Mississippi that actually have been doing well on this metric since the start. You know, Rhode Island's graph is kind of a straight line up in the 90%, so that's great. But others have had some fluctuations or started kind of low and made great improvements. So Alabama, actually the first state. Alabama started in 2022 with 68% of calls answered and is now up to 91%. So they've made great improvements. And then, although they still have a long way to go, Florida has also brought their answer rate up from 54% to 77% most recently, with a few months in the middle that go over 80%. So just a shout out to states that have made some great improvements over time. Thank you so much.
Great. Natalie, is there anything that surprised you about this data?
I think I was actually honestly surprised by some of the states that are doing so well. I think Rhode Island makes a lot of sense. It's a pretty small state, so in-state answer rate. But I think it's fantastic that Mississippi is right behind them. And it's also great to see states that have made improvements. There are some that have, gone up and down, but some who have had some pretty clear improvements, and that I think is great to see. Just hopefully that equals investment and more people getting the help that they need.
That's great. Yeah, it is really amazing. And there's some great leaders out there that are so dedicated to this and ensuring that answer rate is high. So very excited. I do see the comment about the PowerPoint and data sent our way via email. It'll be on the crisisjam.com website. And so you can go back and see the recording as well as the PowerPoint, any videos, etc. So Natalie, thank you so very much for your work on this. Really appreciate it.
Thank you so much. And I'm happy to put things in the chat as well.
Oh, great idea. Yeah, thank you. And so now we're going to go to Kristen Ellis to bring us home. Go ahead, Kristen.
Thanks so much, Megan. Thank you. Oh my gosh, this conversation with Sophie and Michelle was incredible, and actually hits even closer to home now that I have an infant of my own. I just am really grateful to see that this world and this industry wants to focus on our youth and make sure that the stuff that they need and that they're actually telling us clearly in this generation and what we can implement right away if we actually listen. Huge thank you to our headliner sponsor, Advocates for Human Potential, AHP, and to our opening act sponsor, Behavioral Health Link. Without you, without others that we have yet to announce, we wouldn't be able to keep the jam going every week. And if your organization wants to join this incredible sponsorship lineup, please reach out. We definitely have room for more partners who want to help move this work forward. And please don't forget, mark your calendars. In July, Crisis Now 4 is coming to Washington, D.C., backing up to the NASBID annual meeting. This is our next international convening. Last time it was in Amsterdam, and it's already going to be shaping up to be pretty huge. In Amsterdam, it had more than 13 countries and I think a little over 100 leaders from all around the world. So I'm really excited for that. Look out for some more information about that. Next week, we have no crisis jam. If you celebrate Thanksgiving, enjoy it. If you don't, just enjoy the day off. It's one Wednesday where we officially give you permission not to think about crisis systems. And in 2 weeks, we have Tia Marcel Moretti telling us about the Ohio MRSS story, rapid response with a real impact. I'm really looking forward to that one. In 3 weeks, we have Dr. Deborah Haskins talking about trauma-informed insights into gambling addiction. In 4 weeks, to close out the calendar year, if you can believe it, we have a really cool live and on location jam from JPS Emergency Psychiatric Center in Fort Worth, Texas. Whew, we have a lot coming in the next few weeks to close out the calendar year. Like we said in the chat, if you miss us, you can always look at our playlist for your Crisis Jam fix. So thank you so much for watching. We want you to tune in, log on, join the movement, and we will see you in 2 weeks.